Tell us a little bit about what are you doing and what will you be doing with this extra support to improve sanitation in schools?
One of the things that we're doing at Water for People and we're very excited about is we take the issue of monitoring very seriously. And we've done it in a very different way. What we're going to do is we're going to bring in employees from ITT and from other institutions, WEF, American Water Works Association, IWA, the North American Water and Sanitation Community, to go in and ask really hard questions about the work that we're doing. They're the ones who are going to monitor it. They're the ones who are going to come back and say, this is what we think you're doing well, this is what we think you're not doing well, and this is what needs to change. Let me give you one example, one concrete example of a change we've had. In India, we've initiated a program where girls are designing their own toilets. And it's been fantastic because it gets them excited about sanitation. It empowers them in many senses to take control of their sanitary health, if you will. And one of the things that our monitoring program was finding is that girls were still not using the toilets that we were constructing. When we said to girls, how would you do this? How would you initiate this program? They always said the same thing. We don't want the toilet in front of the school because every time we go to the bathroom, everyone knows we're going to the bathroom. We want it in the back of the school. We need in the toilets areas where we can take care of our menstrual health in privacy, in security, with cleanliness. They've redesigned the way the taps work. They've included things like mirrors so that they can actually see on their clothes if they've had spots or things like that. All of this came about because hard questions were being asked about the work that we were doing. So the latrines were functional, but were they being used? No, they weren't.
Innovation will help bring safe water and sanitation to those in need. Take, for example, West Bengal, India, where water in 8 of 19 districts is riddled with arsenic. As a result, West Bengal has one of the world's highest levels of water-related illness. The development of simple, locally manufactured filters that remove arsenic from the water supply at public wellheads has made a huge impact in reducing the incidence of disease in the region. To advance this innovation, Water for People with ITT support plans to install 15 arsenic filters at schools in the West Bengal region.
What can the average citizen do to either become involved or either change their habits or impact the world?
Well, we're starting with ITT employees and we're giving them 2 options. They can donate money, they can donate their time. And that's a wonderful place to start, whether it's awareness, hygiene education, or the advancement of new technology.
I would just build on that, the donation of time in many senses is the donation of their intellectual and kind of curiosity capacity. What I think needs to happen is people need to ask much harder questions, to be honest. We can no longer accept failed water systems. We can no longer accept broken sanitation facilities. And what we need to do is anybody who's interested in these issues needs to not only give their time and their money, but they need to say, show me what this is like in 5 years. Show me what this is like in 10 years. Because I'm not going to invest any longer in systems that fail.
We're talking about a social taboo here. How, in a sense, do we reframe the sanitation crisis?
We need to talk about it, plain and simple. Sanitation tends to be something that we're a bit embarrassed about. We don't want to bring it up in polite conversation. We don't want to bring it up at the dinner table. Well, actually, if we look across our sector to, say, the sector that was dealing with HIV/AIDS or reproductive health, these were issues that were talked about all the time, and you need people to spearhead and champion that, and we have a few of those examples in the sector, but we've got to talk about it. We've got to break down those barriers.
I think we also need to inspire people with real evidence of success, not just kind of fleeting PR. I think we need to be able to show that interventions that happened 5, 10, 15 years ago are still operational, and what has that meant for that community.
Share success, celebrate progress. The notion of making a difference in one area and to the extent the benefits can be observed by another area, I think that's a component of sustainability as well.